Hi.
Hello, I'm Dr. Jwala Srikala, consultant radiologist and breast imaging specialist. Today, let's understand what is breast imaging. Breast imaging, as the word seems, is nothing but imaging the breast. And the most important investigations that are included in breast imaging are mammography and ultrasound, and sometimes breast MRI. So there are two categories of patients who come to hospital who want to have breast imaging done. One category is those who have a lump or a nipple discharge or some concerns in the breast or a simple pain in the breast. So for those women with symptoms, if they are over the age of 40, then we start imaging them with a mammogram followed by an ultrasound. Now, with the help of mammogram and ultrasound, if we identify a problem, then we go ahead and do a biopsy if required and send the tissue for further evaluation in the pathology labs. Now, if the woman is under the age of 40 and has some complaints or concerns, then we start investigating her with an ultrasound of the breast, and if we think that a mammography is required, then we go ahead and do a mammogram and then biopsy and so forth. Now, if the woman is asymptomatic, meaning she doesn't have any symptoms but has come to the hospital to know if she has a breast cancer, then in her, if she is older than 40 years of age, then we start investigating with a mammogram and an ultrasound, and if there is no abnormality, we send them away with an advice to come back next year for breast cancer screening. And if we identify an abnormality, then we do a guided biopsy depending on whether it is seen on mammogram or an ultrasound, and then evaluate her further with pathologic tests. If the woman is asymptomatic and she's under the age of 40 and wants to know if she has a breast cancer because she has a strong family history or she's worried, then we do an ultrasound of the breast, and if we are sure that we are not missing any abnormality, then we let her go. And if we identify any abnormality, then we may further need to do a mammogram for her and then a biopsy. Now, sometimes after a woman is diagnosed with breast cancer, or if she is from a very strong family history of breast cancer, or she's undergoing therapy for breast cancer, in such situations we may also have to perform a breast MRI. So MRI, I'm sure most of you have heard in the context of MRI of brain or MRI of spine. Similarly, we also can perform a breast MRI, and breast MR is one of the most sensitive investigations to pick up early breast cancer. So it is commonly used in young women with strong family history of breast cancer. We also use breast MR to know if a woman who has been diagnosed with breast cancer is sensitive to chemotherapy. Is she responding to her treatment or not? Or sometimes in women with multiple cancers, we would like to know if there are any other cancers in the contralateral, which means the other breast also. So in such situations also we use a breast MR. So breast imaging broadly means mammography, ultrasound, and if and when required, breast MRI. Thank you.